All right, let's get started. So I'm just periodically when I look down this way, I'm looking at my notebook to make sure I cover everything. I just want to quickly go over what we're going to talk about today. So I'm going to go over breathing at a very base level, like what's happening in your body. And then I'm going to talk about the muscles of the core because obviously the lungs are what take oxygen in and out, but the muscles of the core and of your chest and back all are part of breathing process as well. And then we'll talk about kind of regular breathing patterns, like when you're not thinking about it, and then other types of like forced inhalation, forced exhalation, and what those might do to your CNS, your nervous system. Then we'll talk about your some like really common types of breathing dysfunction. Especially, I mean, I work a lot with pregnant and postpartum women, but this applies to everyone. But I'll give a couple like pregnant and postpartum specific ones as well. I'm also 26 weeks pregnant, so you'll get to see what the real impact of some of that on my rib cage. And then we'll go through, I hope, quite a few exercises, keeping an eye on time, of course. And then last, we'll talk about how to incorporate breathing into exercise. How do you take it to the next level once you kind of spend the time breathing, increasing your rib mobility and your understanding of how your body works. And then any questions. So again, just unmute yourself or pop any questions into the chat if you have any as I'm going, and I will do my best to answer them. So breathing at a very base level. So obviously our lungs fill with air when we breathe, and then we expel carbon dioxide and other gases as we exhale. So what's happening, just as you're not thinking about breathing, you don't have to tell your body to breathe throughout the day, right? So as you're just sitting there and breathing, what's happening is you have this muscle called the diaphragm. It's a dome-shaped muscle at the bottom of your rib cage, and it is actually contracting and descending, and you have these intercostal muscles between your ribs that are actually kind of pulling your rib cage up, and your rib cage is getting wider, which decreases the pressure inside your lungs, which then because pressure has to equalize, you then draw oxygen in, and then you exhaling, the diaphragm relaxes and comes back up, and your ribs come back in, so it's making that space smaller, and you exhale. So this is an automatic breathing pattern that we do, that everyone does all day long. You don't have to think about telling your diaphragm to contract and relax. It just does it naturally. We'll talk about that more later, because you can have dysfunction where you are breathing with a lot of other muscles rather than your diaphragm. But that's kind of like 101 of oxygen coming in and out. So diaphragm descends and rib cage opens up, decreases pressure, oxygen comes in, then diaphragm comes up, muscles come back in, rib cage comes back in, pressure increases in there, which allows you to expel air. So that's what's happening in your lungs. But at the same time, we'll back up a little bit so you can see my body a little bit. So while you have your diaphragm here, as your diaphragm is descending, when you're inhaling, what's happening is that something needs to happen in this part of your body, because two things can't take up the same space, right? So as your diaphragm descends, it's going to move your internal organs down. And there's a couple things that can happen. One is that we can have muscles that relax and expand and allow our belly and our back and our sides and our rib cage to expand and make room for those muscles. Or we can hold tension in our core and our pelvic floor and stuff. And then there's an increase of intra-abdominal pressure in our core. So just kind of like basics of pressure when you're breathing. But let's take it a step back again. And we're just going to talk about the muscles of the core and what actually, what makes up this lower portion of your core. So you've got, I got a prop over here. I'm going to grab a couple of them. So I want you to think of your, oh, sorry, bowls are loud. I want you to think of your core canister is what we're going to call it, as a soup can, where the top of it is your diaphragm, that dome-shaped muscle here. The bottom is your pelvic floor, which is another dome-shaped muscle. And then the sides of it are all of your ab and back muscles that make up your core canister. And in an optimally working system, it all moves as a unit. So the diaphragm descends, the pelvic floor descends, and soup cans are solid, but your abs and your back would expand in 360 degrees. And then you exhale and everything comes up together. Pelvic floor comes up, diaphragm comes up, and your muscles in your core come back together. And I know I just threw pelvic floor out there. So of course I gotta bring out my pelvic floor model. If I take out the internal organs in here, you can see that when I talk about the diaphragm being dome-shaped and the pelvic floor is dome-shaped, it's kind of bowl-shaped here. They're opposite of each other, right? So the diaphragm is this dome shape up by your ribs, and your pelvic floor is in the opposite direction in your pelvis. So when you inhale, they both descend, and then when you exhale, they both ascend. Again, in an optimally functioning core. So diaphragm, pelvic floor, those are the tops and the bottoms. And they're kind of your diaphragm here is a separation between your lungs and your abdominal cavity. And then your pelvic floor actually supports your pelvic organs and your internal organs. And it's kind of a literal floor to your abdomen that holds, all of your guts. Then you have your core musculature. So you've got a couple of layers of deep abdominals. The first one I'm going to talk about is your transverse abdominis, which attaches in your back, into your ribs, into your spine, and it wraps around, and then it meets at your midline. They don't actually meet together. They meet a line of fascia here. So the fibers run this way. So because the fibers run this way, when the muscle contracts, it brings everything in. It's called a corset muscle. Think of it like bringing everything in together. And then it, when it relaxes, comes back out. So when you breathe, your TVA is one of your transverse abdominis muscles are one of your breathing muscles. So inhale, they should relax. Exhale, they should bring things in if you're activating them, which you don't necessarily need to all the time. Your next set of internal abdominal muscles are your internal obliques, and they attach to your ribs, and the muscle fibers kind of run down, attached to your hip down here. So it's responsible for, lateral flexion on either side, or if they're both firing on both sides, flexing your core this way, but it's also responsible for bringing the rib cage down. So again, those kind of run in this direction. Then you have your external obliques, which also attach up here, but the fibers run a little more in this direction. So they're responsible more for bringing a rib cage in this direction, kind of across the body, as opposed to just straight down. So internal obliques down, external obliques kind of across. So they're also part of breathing, what expands and contracts during breath. And then you have your rectus abdominis, which is your six-pack abs, you kind of traditional, when you picture abs here, responsible for flexing the spine. So your diaphragm, your pelvic floor, and then those muscles of the core, the multifidus in the back kind of runs along the spine, also helps stabilize your spine and create stability during a breath. So when you're in an ideally functioning breathing system, when you're not thinking about it, when you're just breathing throughout the day, those are kind of minute movements that are happening: the diaphragm, the pelvic floor descending and ascending, the muscles in your core expanding and contracting. You're not doing anything to make that happen. It's automatic. You can have dysfunction with that, where those things aren't working quite well together. We'll talk about that later. So again, an optimally moving system, that's how they work. Check, make sure there were any questions. Don't think so. So now that we've kind of touched on this, but now that we kind of know muscles of the core and how the diaphragm, the pelvic floor, the abs, the lungs, the chest, they're all interconnected and they all work together. Let's talk a little about passive inhalation versus passive inhalation exhalation versus forced inhalation exhalation. So passive breathing is what I've been talking about, like the type of breathing that you're doing all day long without thinking about it. But you can also have forced inhalation or forced exhalation, where you're getting other muscles working and kind of helping that breathing process. So in a forced inhalation, what you get is you get a lot of other muscles, usually kind of upper body muscles, involved in the inhale to help expand the rib cage even more, to get more oxygen in. So forced inhalation is really common during like higher intensity activities. When you're like panting, you can kind of feel like muscles up here working when you're working out hard and breathing hard versus, just your everyday all day long breath. Something else to know about that forced inhalation breathing is it can, if you're using a lot of those other muscles like your neck, your shoulder, your chest muscles to breathe a lot when you don't need to be, it can impact your central nervous system and your anxiety and your stress levels and stuff. And we'll get into that more in a minute. But if you are constantly in a state of like breathing with they're called accessory muscles, that's not a place you want to be. But it does have a role in a normal functioning body. When you're working out, it's going to be part of the process. So that was forced inhalation, but you can also have forced exhalation. And sorry, I'm going to back up one more thing on forced inhalation. Forced inhalation, I just talked about a lot about the upper body and chest kind of helping breathing, but I would also put some of the breathing practice, like the diaphragmatic breathing we're going to talk about, I would kind of put that in forced inhalation too, because when you do diaphragmatic breathing, you're going to be really focusing on like connecting, thinking about that diaphragm muscle and expanding it as much as possible and breathing deeper than you normally would. So I kind of think of that as like a forced inhalation too, but has a different impact on the central nervous system. Okay, now forced exhalation. So forced exhalation is like a hard breath out. You're not just letting the air kind of flow out as pressure changes are happening between your lungs and the outside air. You're using usually your pelvic floor and your core and your diaphragm and some of your intercostal muscles to force the air out quicker at a higher velocity. So forced exhalations are a good way to get a little bit more of a core connection, because you're going to be turning on your ab muscles on that exhale. So there are different ways to cue diaphragmatic breathing that we'll talk about when we get to the exercises that focus more on like a forced inhalation and spending more time trying to like fill your lungs, or more on like a like forced exhalation with added pressure. So we talked about regular passive inhalation, exhalation, and then forced inhalation and forced exhalation, and how they use different muscles of the body. And we can breathe in different ways to manipulate what we want our body to do. Like, that you could breathe like that and make yourself hyperventilate. Or that breathing like that causes you to hyperventilate, right? And you also probably have heard as like a stress and anxiety reducing tool to take deep, slow breaths. And what I'm going to teach you, hopefully in this webinar too, is a little bit about how you can use it to impact your rib mobility and your spinal mobility and even your hip mobility, and how breathing is really a secret tool for kind of getting the most out of your exercise. So we can manipulate how we breathe to get different responses in our core system. All right, let's talk about our central nervous system for a second, because our breathing patterns have the ability to impact our central nervous system. So the sympathetic nervous system is your like fight or flight response, and your parasympathetic nervous system is your what do they call it, eat and digest or something like that, but it's all like a relaxation state. So when you breathe deeply, when you do diaphragmatic breathing, rest and digest, thank you. I do something like that. Pregnancy brain has been very bad for me this time around. So much worse than my first one. So when we do deep diaphragmatic breathing, it is a great way to bring around that parasympathetic response and get some relaxation. You actually have your vagus nerve runs through your diaphragm. So when you do big, slow inhales and especially long exhales, you actually stimulate the vagus nerve and can help with that relaxation sensation. And then on the opposite side of that is if you are a really shallow breather and you're using a lot of those like accessory muscles, like if you think about like feeling like you breathe up into your shoulders or chest or hold a lot of tension, it can do the opposite. It can actually bring you into your sympathetic state, your fight or flight state, and it can increase anxiety, increase your heart rate, stuff like that. So because breathing is something we do all day long, constantly, whether we're thinking about it or not, our breathing tendencies and our muscle balancing between our diaphragm and our other chest muscles, they have an ability to impact our our central nervous system all day long. If you are someone who doesn't know how to breathe deeply and doesn't have a lot of like range of motion in your diaphragm, which is a muscle, like you need to work a muscle, you need to work your bicep and have a full range of motion. If you don't have full range of motion in your diaphragm, if you're kind of like stuck in a state of inhalation or stuck in a state of exhalation and other muscles have to take over, you might end up creating more of a stress response in yourself. So breathing is just extremely important for both like mental reasons and physical reasons, just general like body mobility. So we're going to talk now about some of the common types of breathing dysfunction. A lot of people probably go through their life without ever thinking about breathing or how it impacts them. I know a lot of people who have done yoga tend to be a little more in tune with their breathing, but I'm someone who played soccer in college, to the college level, and all I thought about breathing wise was like my aerobic capacity, how well I was breathing while I was running, to get enough oxygen in. I never thought about it from any other standpoint until the last few years. So kind of just was talking about this, but one type of breathing dysfunction is the like shallow breathing. I'm going to call it chest breathing. It just makes me think of someone who's kind of like tight through here, like the ribs aren't able to open a lot. It's going to inhibit your diaphragm movement if you're using all of your accessory muscles, your neck muscles, your chest muscles and stuff to breathe rather than your diaphragm to breathe. And it's going to increase that sympathetic nervous system response. Also you might have a lot of like upper neck tension, back tension, stuff like that, if you are using a lot of those accessory muscles all day long to breathe instead of your diaphragm. Another one, and this is a big one, this is a huge one, that like some people don't even know they have a pelvic floor. Everyone has a pelvic floor, men, women, everyone can have pelvic floor dysfunction. Athletes tend to lean towards more of a hypertonic pelvic floor where you still like holding a lot of tension all the time. Women have been told for a long time, like just do your Kegels for pelvic floor issues and stuff, but that can create a lot of tension. And another thing that can create tension in your pelvic floor is if you don't know how to lengthen it on the inhale. So if you were to take a big deep breath in, just do it with me now, like take a big inhale. I'll coach you more later, but just think about taking a big deep breath in and exhale, and just think about whether you can feel anything happening in your pelvic floor. So go ahead and take another deep breath. And then let me know if you can go ahead and either message me in the chat or unmute yourself and let me know if you think you felt something or have no idea what to even look for. Okay, that's good. So what I'm gonna show you as like a manual way to check on yourself. So what I'm gonna do is place my fingers on myself. I'm gonna find my sits bone, like right under my butt, find my sits bone. And then if this is your anus here, you're gonna kind of place your fingers like right inside of it. Sorry, I'm reading. While initiating, my core is contracting. While inhaling, your core should be relaxing. So we'll get into this more of the diaphragmatic breathing, but your diaphragm should be descending, and then your body in 360 degrees should be expanding out, and then your pelvic floor should be descending. So don't worry about it. We'll do some practice, and it does take practice to get there. But for now, let's check and see if we are feeling movement in our pelvic floor. So if you can find your sits bone and kind of put your fingers right between there and kind of between your bum there. And then what you're feeling is actually pelvic floor tissue. And then if you take a big inhale in, trying to focus on that area, do you feel any movement there? On the exhale, do you feel it come back up? So on the inhale, are you feeling it descend at all? And on the exhale, you're feeling it come back up. The position I'm sitting in, I actually can't feel anything because I'm sitting on a pillow on the floor. I think if I were sitting on a chair or something, it'd be easier. But I definitely feel a little bit of movement there. Good. Good. I'm glad you can feel that. So that is a good indicator that your pelvic floor is moving, which it should. So again, on the inhale, let me grab my bowls again. On the inhale, your diaphragm and pelvic floor are descending. Your pelvic floor is relaxing as it descends. And then on the exhale, they're both coming up. And on the inhale, your core in 360 degrees. So your abs and your back, we don't want to forget about the sides and our back ribs are expanding. And then on the exhale, they're coming back in. Again, we'll get into more practice with that. So if you have poor coordination in your breathing system, in your core, your pelvic floor, and your abs, it can cause tension in your pelvic floor. It can contribute to symptoms of prolapse. Alternatively, if you're always holding tension in your pelvic floor, you might find you have a diastasis you can't heal because the pressure is always going in the path of least resistance. So it's going out through your stretched linea alba, which happens during pregnancy. You could have, if your pelvic floor isn't moving well, you could have low back pain and tension. So again, your pelvic floor is a group of muscles, and muscles always have a full range of motion that we should be working them through a contraction and a relaxation. Range of motion. So that was our second form of dysfunction we're talking about. And then the third one, and this is a huge one for women in particular, and I feel like this is one you'll be able to talk a little bit about with some of your clients, Savannah, is upper ab gripping or cinching, or it's even called hourglass syndrome. And the idea of it is we want to make ourselves appear smaller, and it is nearly impossible for me to do right now with this belly, but we will end up gripping our upper abs. I don't know if you can see this. Do you see how much tension I'm holding right there in my ab muscles? We'll end up squeezing our upper abs, and that can also inhibit our diaphragm being able to expand. Because think about what your diaphragm is. It's this dome-shaped muscle that attaches to the bottom of your ribs. If you're constantly sucking in and holding tension in your upper abs, you're inhibiting the ability of that diaphragm to contract and relax while breathing. And on top of that, if you're constantly holding tension here and holding this area tight, the intra-abdominal pressure that's created when you breathe and when your lungs expand has to go somewhere. So sometimes it might go down on your pelvic floor, depending on your breathing and bracing and other strategies and where you have weaknesses. So it might put pressure down on your pelvic floor, and you might have like leaking, incontinence issues. Or, if you're cinching down on your upper abs all the time, it might be putting pressure out through your midline. And you might end up, again, it's really hard for me to show this being so pregnant, but if you're like cinching down here, it might kind of force pressure this way, giving people the appearance of like, the dreaded pooch and stuff like that. So you want to like let your muscles go, let them relax. And it's a real problem that people subconsciously, like this again, it sounds like you're like purposely like cinching down your abs, but it ends up being this subconscious response that people have of just trying to look thinner and just holding tension there, sucking in all the time, can impact your breathing machine. Don't know why I just called it a breathing machine, but we'll go with it. And then the last one I want to talk about for a breathing dysfunction is pretty relevant to pregnant and postpartum people. And I'll actually probably be able to show this pretty well, hopefully on my rib cage. But you have this thing called an infrasternal angle. And if you can picture where your ribs separate at the bottom, your ribs should be at about a 90-degree angle coming down. When you're pregnant and the baby starts to take up room, your rib cage actually expands. So right now, if I walk my fingers down my rib cage, I'm at an angle of about here. So I have a wide infrasternal angle right now, but that is 100% normal and 100% part of pregnancy. And it's the way your body makes room for the baby. But people can have this wide rib cage angle or even a narrow rib cage angle. And that can impact your ability of your diaphragm to move, because again, your diaphragm is attached to your ribs and it moves as they expand and contract. Like it relies on your ribs moving for your diaphragm to work well. So this infrasternal angle can contribute to breathing dysfunction. And it's not just pregnant, postpartum people. It's just the fact that when you're pregnant, your infrasternal angle automatically widens, that it can be tricky to recognize that. You can also have uneven, like you can have this side be at what would be a 90-degree angle and this side open up further. And that's going to impact how your diaphragm works too, right? Because then it can't kind of work as a system altogether. So infrasternal angles, your infrasternal angle is ultimately impacted by your core musculature. So like if you have a wide infrasternal angle, do you remember at the beginning, I said you have your external obliques that kind of bring your ribs down and across this way. So you might want to work on external oblique strength to help bring that rib cage back down and in. If you have a really narrow rib cage, you might have overactive external obliques, and you might need to work on deep breathing and things to kind of get your ribs to open up again a little bit. You might also hear this infrasternal angle stuff referred to as a state of inhalation or a state of exhalation. And what that means is when you inhale, your ribs expand in 360 degrees here. So part of inhaling is allowing your rib cage to open up a little bit. And a part of exhaling is getting the ribs to come back down and in. So if you hear someone is stuck in a state of inhalation, it usually means their rib cage is kind of wide. And if they're stuck in a state of exhalation, their rib cage is a little more narrow. But either way, your diaphragm isn't able to work optimally and your core is not able to work optimally in your pelvic floor. And it's not like all of these things are only a problem if it's causing you a problem, if that makes sense. Like, I think everybody should work on breathing, but I don't think you need to go like assessing your body for all of these things. If you feel like you have a functioning core unit, then you don't need to like go looking for problems. But if you have issues, then it's definitely something to look into. And going to a PT, especially like a pelvic PT who's educated in it, can help, because they can help you figure out what your rib cage angle is and what exercises to do to open it or close it, stuff like that. So just went through a whole lot of information. We're about to get, let's see what time it is, 7:43. Perfect. So we're about to get into some of the exercises. So before I do either of you guys have any questions? And also, I'm going to take a second to drink. I'm okay, question mark. No, good. All right, so giving you a lot of information. I'll send this out so you can re-listen. But the next question is, what can you do about it? What can you do if you feel like you have some sort of breathing dysfunction? Or even if you don't have that good connection with your body, so you don't know what's happening when you breathe, like what's the next step? And the answer is breathing practice, because just like every other form of exercise, we're training muscles, working on the mind muscle connection, and it takes practice. And as a newly postpartum person, or for a newly postpartum person, I would only have them be doing like 5 to 10 diaphragmatic breaths, like 2 to 3 times a day. Like your core is recovering. You don't need to add a lot of stress to the system. So like a newly postpartum person in like the first 6 weeks doesn't need to be overdoing any of this. But if you are like a healthy individual and you're just working on improving your rib mobility and your core connection and your mind body connection, then you could start with like 5 to 10 minutes of breathing 1 to 3 times a day, honestly, however much you want to fit it in. And I always tell all of my clients that one of my favorite times to practice deep breathing is in bed, because it does get that parasympathetic relaxation state going in your body. It's really helpful before you go to sleep. And as a parent, I like to do it weirdly in the car. Car is usually a stressful place, so I'll do some deep breathing exercises in the car, or like while I'm waiting for my kid to eat food or something. I'm just kind of staring at them. All right, so now what kind of exercises can we do? And I'm going to start with the very most basic one, and I'm going to kind of talk through these and show them. But I'm going to be talking a lot. I want you guys to be, if you're comfortable and in a place where you can, actually doing these positions with me and practicing and feeling what you feel. That way you can we do breathing exercises while sitting or standing? Yes, I like to start with breathing practice in the hook lying position, laying on your back with your knees up. I'll show you in a second, mostly because you like take gravity out of the picture. But you can do it sitting. So if you're sitting and can't lay down, that's fine. So this is, let me point this down a little more. This is the hook lying position where you're just on your back, knees bent. So the first exercise is just diaphragmatic breathing one-on-one. And before you even start, I just want you to place a hand on your belly and hand on your chest, and just take what you consider a deep breath. and feel what's happening with both of your hands. Exhale, feel what's happening with your hands. Do one more. So let me just remind you that in an optimally functioning system, what's going to happen is, of course, your chest is going to expand a little bit. This hand's going to come up a little bit because your lungs are filling with air as your rib cage expands. But you should also be feeling movement in your ribs out to the side, maybe hopefully your ribs into the back, and your belly should be coming up too. And then on the exhale, core should be coming back in, chest should be coming back down. What you don't want is to feel this inhale up into your shoulders. So you don't want to feel this inhale up into your shoulders while your belly comes down in on the inhale. So see how shoulders are coming up and belly's kind of coming down? You don't want that, because what that is saying is you're using a lot of your accessory muscles to breathe, and that you're not getting good expansion in your core. So I want you to think about this dome-shaped muscle that you now know is at the bottom of your ribs. And again, it's attached in the front and the back and the sides. So I want you to think about breathing in and letting that expand as much as possible in 360 degrees. And then exhaling and feeling it come back in. See if you can feel some movement in your ribs. Once you feel some movement in your ribs, then focus on what's happening a little bit lower down. So in your belly, but also in the lower part of your back, your lower back into the floor. Same thing. Can you feel some movement in all directions on the inhale? And then it coming back in on the exhale. And then lastly, take another breath thinking about your pelvic floor. So on the inhale, can you feel your pelvic floor relaxing and lengthening? And on the exhale, can you feel it contracting? So this is a very basic hook lying diaphragmatic breathing. If you're doing this in sitting, it's all the same thing, just a different position. So you're going to take a deep breath in, feeling that diaphragm and your whole core expanding. Try to breathe in for like 4 to 6 seconds, and then exhale for a little bit longer than you inhale. So try to hit like 6 to 8 seconds on the exhale. It can be helpful while you're doing this to inhale and then exhale until you have nothing left. Keep going, keep going. And I think as you have less and less and less air left, you're really going to feel your ab muscles contracting and coming in your pelvic floor. Now you can take a diaphragmatic breath to the next level and do what's called a connection breath. So connection breath is, it's just adding a little more of a focused pelvic floor contraction on the exhale. So instead of just kind of the muscle like naturally contract, you're actually going to do almost like a little bit of a Kegel, but not like a max contraction. You're just getting a little extra activation. So you're breathing into your ribs, into your core in 360 degrees, breathing into the floor. And then on the exhale, as you're exhaling and running out of air, start to contract your pelvic floor. Keep exhaling. Keep exhaling, keep exhaling until you have nothing left, and you should feel your pelvic floor contracting. Hold it for a second or two when you're at your max exhale, and then inhale again. So that is what every single one of my clients starts learning breathing on, is your diaphragmatic breathing and your connection breath. So you can see how if you're taking 5 to 8 seconds to breathe, that you are quickly going to hit a minute. It only takes like 5 or 6 breaths to get to a minute. So spending that 5 to 10 minutes doing breathing actually goes by pretty quick. And then it goes by even faster when you have additional exercises that you add in to reach different areas of your body. So we talked about the hook line, diaphragmatic breath and connection breath, which are basically the same thing. One just has a little more of a little more emphasis on the pelvic floor. So I'm just reading my notes. You can also do the exact same breathing. Again, in sitting is fine. Another place I like to start with people is side lying. And the main benefit that you can actually put like a towel roll or pillow or something under your side to help you. The thing I really like about side lying is you can feel a little more of a rib expansion up top. You know, you start to move your focus from like your belly moving to more your rib moving. But it's the exact same thing, focusing on that inhale, letting your diaphragm expand. Exhale, letting it come back in. So hook lying and side lying are great places to start, and sitting. I usually would do hook lying, side lying, and then sitting, and then eventually progress to standing too. And I'm going to ask you guys a question again. If you did those exercises, those breathing exercises, did you feel like the things that I were saying were making sense and that's what you were feeling in your body, or did you feel a little lost? Good. Glad you felt that. Great. Perfect. Because that's like the root of all breathing, right? If you can't feel your diaphragmatic breathing, if you can't feel your diaphragm lowering, your ribs moving, your pelvic floor lowering, your abs going out, and then it coming back in on the exhale, then you need to keep doing those very basic exercises until you get that mind-body connection, or the rest of them aren't as functional. But you both got it, so that's good. I'm going to do one more breathing exercise that's just focused on breathing, not in any particular position. I'm just sitting on a pillow, so you can go ahead and do this sitting. So this is one of my favorite ways to really feel the diaphragm moving. So you're going to take a breath in for like 4 to 6 seconds. Then you're going to exhale until you have no air left. When you have no air left, I want you to hold that exhale. Don't take any air in for like 2 to 3 seconds, whatever feels safe to you. And then you're going to take an inhale in again. Big inhale. Don't really worry about like what's happening in your posture changing or whatever. Just let your body do its thing. Big inhale, and then exhale everything out until you have no air left. And then again, hold that for like 2 to 3 seconds, and then take an inhale. I'm going to do it with you in a second. Hopefully you've gone ahead and started, but this is a really good way to get some of that connection going. And I think it's because when you're not breathing, your body just kind of like knows how to more efficiently get oxygen. That's my working theory anyways. So I'm going to join you now. Sorry, I was holding my exhale. I almost always inhale through my nose and exhale through my mouth. Inhaling through your nose is nasal breathing in general is just like really beneficial for exercise and whenever you can do it. And then exhale, especially because I'm telling you to like keep exhaling until you have no air left. I like to exhale through my mouth. It also feels kind of the most natural to me. I'm going to do one more. You can do one more breath this way. And I'm I'm just curious, do you keep it closed or open? Let me see. I don't know off the top of my head. Mouth is closed on the inhale and then open on the exhale. Sorry, just saw that question. So yeah, mouth shut, breathe through the nose on the inhale, and then on the exhale, mouth open. Let it go through your mouth. So did either of you guys feel any more like rib expansion or anything when you did that? Did you feel more of like the diaphragm movement? Yeah, good. Yeah, so do I. Whenever I do that breathing exercise, holding the breath for like 2 to 3 seconds, I always feel like I get better expansion. So that's always something you can do in your breathing practice too. There's so many different ways to incorporate breathing practice. That's just one of them. All right, so we went over hook lying. Good. We went over hook lying. We went over side lying. We went over the exhale for 2 to 3 seconds. Okay, now we're going to get into like my more like rib mobility exercises. And what I mean by rib mobility is you've got lots of like intercostal muscles in your ribs and your spine's meant to move and stuff like that. And you might have stuck areas, especially, like pregnant women tend to get real tight in their lower back. So your back ribs in this area might need some extra expansion and stuff. So a lot of these next exercises I'm going to show you are all different ways to get expansion in different areas. So I like to focus on side ribs next, just because I think it's easy for everyone to kind of feel their side ribs more than their back ribs. It gives you an idea of like the sensation you're looking for. So I'm just sitting kind of in like a 90-90 on the floor. You don't have to be sitting in this position. I just find it helps. You see, I'm like already leaning to one side to hold myself up. So all I'm going to do is lean further into that side. So I get some stretching going on the side of my body. And then I'm going to place my hand right on my side ribs here. This hand is just kind of resting down on this leg. And I'm going to do my diaphragmatic breathing. Big inhale through my nose, but I'm focusing on trying to expand the area of my ribs where my hand is. So using some tactile feedback in my hand to work on opening the ribs there. And on the exhale, feeling them come back down and in. So same thing, inhaling 4 to 6 seconds, exhaling 6 to 8 seconds. You could also do the breath holding here if you wanted to as well. But you would take a couple breaths on either side, then you'd switch sides. So now I'm leaning this way. So I'm going to lean into that, feel a stretch on my side of my body here, and take an inhale into my hand, feeling my ribs expand there. Feel them come back down and in on the exhale. So hope, if you're sitting, you could just like lean to the side and get the same thing going. So hopefully with that exercise, you felt a little bit of the side rib expansion and kind of the sensation of like, oh, I'm feeling a stretch here on my side. Seems like a good time for me to like focus on breathing into that stretched area and getting even more expansion in that area. The next exercise, I usually go from there for side ribs. These breathing exercises help healing diastasis. Yes and no. Yeah. Breathing is a really important part of diastasis healing, because if you don't have rib movement in the back and in the sides and in your pelvic floor, your core, which was stretched out during pregnancy, is the path of least resistance. It's already stretched out. Your body already Like it's easy to send pressure there. So when I talk about your intra-abdominal pressure increasing, when you inhale and your diaphragm descends and it kind of displaces your internal organs, if you don't have the ability to expand your back ribs and your side ribs and your pelvic floor, it's just all going to go out on your linea alba potentially. So hopefully that makes sense. And then on top of that, those forced exhalations, like watch, it's one of my favorite parts about having a pregnant belly is being able to see how much your core works during a breathing exercise. So I'm going to show you like a forced exhale where I really get my core working, and you can see just how much your abs have to do while you're doing it. My abs are on fire right now, and I have made my 27-week baby look more like a 20-week baby. So these breathing exercises are also working your ab muscles, especially on those forced exhalations. So hopefully that helps answer your question. There's a lot more to diastasis healing than just that, but I think having the ability to breathe into other areas of your body, in particular, the most important one being your back and your pelvic floor, is important for diastasis healing. All right, so next side rib exercise I love. Oh, let me tilt this up so you can see my head. So I love a good hip flexor stretch. So I should have turned the other way, but I'm stretching my hip flexor of a leg that's closest to the wall. I've kind of got like my butt tucked under. I feel a good stretch right across the front of my hip right here. So this area is getting a really good stretch right now. So what I'm going to do is actually reach overhead on that side. So now I'm getting a good stretch all along this part of my body. And I'm going to do the same thing I was doing with the side rib breathing, where I breathe into my hand, but I'm getting a little added extra stretch along this whole side of my body, which is really going to hit some of your like oblique muscles and get them expanding and relaxing too. So same thing, focusing on breathing into your ribs where your hand is, and then exhaling them, feeling them coming back in. Inhaling, feel your ribs expand. Exhale, feeling them come back in. And side on view of that, actually, I'm going to switch sides, switch legs that's down, but side view of that looks like getting a good hip flexor stretch, reaching up overhead, focusing on breathing into my hand, this area of my ribs. Hopefully you feel a good stretch along this line of your body, and hopefully you feel some rib movement happening here in your side. That's one of my favorite like warm up breathing exercises, which is often where I do these breathing exercises. So we went over side rib, we went over hip flexor side rib. Now I'm going to do deep squat breathing, and I'm going to grab a yoga block. Now I would, if I had a better setup here, I would actually hold on to something in front of me. You know, if I had a door frame or a post or something, I would hold on to it this way so that I'm really getting some support here. But you can see I'm like sitting in as deep of a squat as that is comfortable to me right now. I cannot possibly put my feet any closer together with my belly. But if you don't have a giant baby belly in your way and you do have a door frame to support you, you could put your feet and knees together and grab the door frame for support. So that would look like side on. That would look like your feet and knees together. And what that does is create this like little bit of rounding in your lower back and stretching your lower back. For me, I'm just going to sit on a yoga block. I'm sitting and I'm kind of letting this lower portion of my back here relax and stretch a little bit. Now, just like we did with the side rib breathing, you find the area of your body that you feel stretched a little bit. So for me, right now, it's my low back area because it's so tight. And then you're going to focus on inhaling into your ribs there. So you're going to focus on kind of directing. You're not actually directing air there. The air only goes into your lungs, but you're focusing on directing that movement into the back of your ribs on your inhale. Exhaling, getting all the air out. I'm so pregnant that it's very hard for me to inhale for longer than like 4 seconds. But inhaling, trying to feel this part of my lower back. Right here, I'm trying to feel this part of my lower back expand on the inhale. And this would be really hard. I am sitting on a yoga block. I'm not like totally on the ground. I don't know if you can see that, but this would be a really hard type of breathing to do if I was like holding an actual low squat. I don't think I could get myself to like relax, and it'd be more focusing on like pelvic floor breathing. So it's important to have that support of either holding onto a pole or a frame or sitting on a yoga block or something so that you can focus on that back expansion. The next one, which is a similar concept and one that I will not be able to show super great being this pregnant, but this is one of my all-time favorite breathing exercises, in particular for the low back. So if you didn't have a giant baby in the way, you would get a pillow or a yoga block or a ball or something and tuck it into your hips and then curl over it. So I'm just kind of in a child's pose-ish position and I'm curling over. This yoga block is doing nothing. I'm curling over my baby. But do you see how when I do this, I do the same thing I was aiming for with the deep back or deep squat, where I'm getting this curve in my low back. It's kind of rounded here, getting a little stretching here. So that's what I want. And then again, breathing into that area of your back, trying to get some back expansion there. And this feels extremely tight on me. This is really challenging. I feel like I can only inhale for like 1 to 2 seconds. So doing your same diaphragmatic breathing, but really trying to send air into your low back on this. And the idea with having like a yoga block, foam roller, set of pillows, a baby, whatever in the front, is that you're compressing your belly in your front, making it hard for that area to expand so you can really focus on getting expansion in your back. That one is next to impossible for me to do. So if you guys are doing that, go ahead and do like another breath there while I look at my list to check what's next. Okay. Next breathing exercise is one I call overhead breathing. So with this one, you'd get in your hook lying position. And you can put a pillow under your head to make yourself more comfortable. But you're reaching your arms overhead. Right now, I just have a yoga block to set my hands on. I don't know if you can see that. But I'm reaching my arms overhead, but trying to keep my ribs from flaring. I'm not letting my low back come off the ground and my ribs flare. I am working on, I'm kind of pushing my low back into the ground as I reach overhead and keep my ribs down. And what that's going to do is create a little bit of tension, like it takes a little bit of muscular control to keep your ribs from flaring overhead as you reach your arms over. And I actually feel my hamstrings are on a little bit, trying to help keep my lower back kind of curved into the floor. And then in this position, you're going to work on your breathing. But again, like I said before, because you're reaching overhead, because you're holding yourself in this position, you might have a little more core activation. And that's okay. That's called eccentric loading.
of your breathing muscles. So the idea being you're holding a little tension, but you're trying to stretch them at the same time with your inhale. Really focusing on trying, for me in particular in this one, I'm focusing on trying to breathe into the ribs that are pressed into the ground. And this one's a little more advanced. So if you feel like you aren't connecting to this one at all, it's probably because you just need a little more practice breathing and rib mobility first. Inhale, trying to expand your ribs, not letting them flare up. Exhale till you have nowhere left. So you definitely want to, when you're reaching overhead, you definitely want to reach to like a foam roller or some yoga blocks or something to make it a little more, so you're not reaching quite so far overhead, whatever is comfortable for you. All right, I've got one more. There's like literally tons and tons of different types of breathing exercises and positions, but I've got one more that's kind of focused on breathing in a specific rib cage area. And then I'm going to talk about some pelvic floor relaxation breathing. So this one, I don't really know what the name of it is. I'm going to point this down a little bit more if I can. I'm going to call it like a hook lying chest expansion. So in this one, I want you to get in a hook lying position and then bring your elbows to your sides, almost like you're doing a row. You'll feel your scapula, you'll feel your shoulder blades kind of come back in behind you. Now, I don't want you, again, to let your rib cage flare up. Keep your rib cage pointing down. But what you're going to focus on in this one is letting your sternum. So I'm not telling you to like breathe into your chest, like breathe this way, but I want you to let your chest expand here on your sternum. So on the inhale, you're kind of bringing your shoulder blades together behind you, feeling your rib cage open up top. And then on the exhale, feeling it come back down and in. Inhale, bringing your shoulder blades behind you. Exhale, relax. Don't move your shoulder blades so much on the exhale. Inhale, shoulder blades behind you. Exhale, relax. So you're trying to get some, because you do need your ribs to move in your chest. It's part of your rib cage mobility, is the movement of your ribs in your chest, but you're trying to get that to happen without it being like chest breathing like this. You're trying to get your sternum to move more. Of course, I will send out, I'm almost done too anyways, but I will send out the recording for this so you can watch the couple of pelvic floor ones. So I'm just going to do 2 pelvic floor relaxation ones. And the first one is going to be, so wide child's pose, right? You have your, well, actually any child's pose position that's comfortable to you. Normally you're like this with your feet kind of in close together, leaning back, trying to figure out the best angle to show this to you. Maybe this way. I'm going to get in a child's pose position, but I'm going to bring my feet out. You see how my feet are now out to the side before I get back in this position. And what that's doing by putting your feet out wide is bringing your hips into internal rotation, which kind of helps open up the space between your sits bones a little bit. So you're gonna get your ankles out wider than your knees and then get in a child's pose position. Whatever's comfortable for you. I'll show you, because I'm pregnant, I'll show you what level of movement I'm getting. So ankles out wider than these, which is the important part, and then just kind of sitting back into it. And then focusing on inhaling into your pelvic floor. Think about your sits bones between your butt over here, trying to expand the space between your sits bones on the inhale. And getting your chest a little lower than your back too can help with the pelvic floor relaxation, because it takes some gravity pushing down on your organs out of it. Inhale into your pelvic floor. Exhale, let it go. Inhale, focusing on relaxing your pelvic floor. Exhaling it out. You can also, if it's uncomfortable to have your knees in that position, you can just do regular like child's pose, wide knee child pose, whatever feels good to you. And then the last pelvic floor relaxation one I'm going to do. Hopefully you can see this okay with the angle of this camera, but with this one, you just need a wall. And I'm going to grab this yoga block. So what I'm going to do is I'm basically going to try and get myself in this type of position, like a happy baby position, but with my feet on the wall. Oh. So you're going to try and get your butt as close to the wall as you possibly can. You're kind of in this like deep squat position. And then you're going to take a dumbbell or squeeze a yoga block or something between your hands and reach up overhead. And that should help get your kind of back pressed into the floor. Just kind of let your legs relax, however is natural. Again, squeezing the yoga block and reaching. And then you're going to, again, inhale, trying to feel that pelvic floor relax and lengthen. And then exhale. Don't force anything on the exhale. Just kind of natural. And then inhale, feel your pelvic floor lengthen and expand. Exhale, let it out. Inhale, kind of continue to reach through your pinkies towards the ceiling. Feeling your pelvic floor expand. Exhale it out. And hopefully there's lots of other pelvic floor relaxation breathing techniques, but those are two of my current favorite ones. So hopefully one of them helps you actually feel that pelvic floor relaxation a little bit more. So those were a lot of the exercises. Like I said, there are lots more exercises than that. I'm like way over. So we're going to go through this next piece really quick. But the last piece I want to talk about before I see if you have any additional questions is how to incorporate breathing into exercise. Because if you have never thought about how breathing can impact exercise before, then this is probably a new concept to you. So I like to think about exhaling with exertion. And the idea behind that is when you exhale and you're using those deep ab muscles to kind of create stability in your spine, you're more prepared to do the hard part of the movement. So for instance, with a squat, not even a squat like a workout squat, I'm also talking about like sitting down and getting up from a chair. The hard part of a squat is going from like the bottom of the squat to standing. So you're going to exhale as you come up out of it. So you're going to inhale down into the squat and then exhale as you come out. Similarly, if you think of like a shoulder press or something, the hard part is when you're fighting gravity and you're pushing up. So you're going to exhale as you push up, inhale back down, exhale up, inhale down. And thinking about, you know, you'll be exercising, so your heart rate will be up a little bit and stuff. So thinking about getting those like deeper breaths, getting your diaphragm moving with those movements. And then there's other types of movements that require you to breathe through a brace. And what I mean by that is, think about a plank. A plank is all about creating that brace, bracing your core, making a nice stable spine, but you still have to breathe while you're doing it because you're usually doing it for a longer period of time. So you need to be able to hold that brace, but still be able to breathe. That's why that eccentric loading of your breathing muscles
is important when I was talking about with the overhead reach, where you get a little bit of like abdominals going and then you're breathing through that anyways. That's something else you need to practice, but that is like more advanced breathing. I have YouTube videos on that and stuff, but I'm not going to get into it too much today since we are so far into it. But yeah, I hope that this was helpful and informative to you, and that it gave you some peace of mind that you are breathing correctly and some ideas of where to take it. But before I stop recording, I'll see if you have any more questions before I end the recording and sign off for the night. Good. I'm glad that they were helpful, and feel free to reach out to me with any questions. I offer one-on-one training, and I have a breathing and mobility program that's it's only 4 weeks long, and it's just kind of like designed to be an introduction. And it basically takes a lot of the principles that I talked about today and applies them to like a 4-week training program to give you an idea of, you know, what you can do with your mobility and breathing and stuff. But I hope that you have a great postpartum recovery, and let me know if you have any other questions. I'm gonna stop recording now.